Quetiapine is a psychotropic agent used for the management of bipolar disorder, schizophrenia, and major depressive disorder. In this video, let's found. What is quetiapine? What class of drug is quetiapine? What is quetiapine used to treat? Who cannot use quetiapine? What are the side effects of taking quetiapine? How does quetiapine make you feel? How to use quetiapine? What is quetiapine? What class of drug is quetiapine? Quetiapine, sold under the brand name Seroquel among others, is an atypical antipsychotic medication used for the treatment of schizophrenia, bipolar disorder, borderline personality disorder, and major depressive disorder. Quetiapine was in 1985 and approved for medical use in the United States in 1997. It is available as a generic medication. In 2020, it was the 64th most commonly prescribed medication in the United States, with more than 10 million prescriptions. What is quetiapine used to treat? Quetiapine is used in the symptomatic treatment of schizophrenia. In addition, it may be used for the management of acute manic or mixed episodes in patients with bipolar I disorder, as a monotherapy or combined with other drugs. It may be used to manage depressive episodes in bipolar disorder. In addition to the above indications, quetiapine is used in combination with antidepressant drugs for the treatment of major depression. Who cannot use quetiapine? Hypersensitivity, hypokalemia, hypomagnesemia, congenital QT prolongation, arrhythmia HX, avoid abrupt withdrawal. What are the side effects of taking quetiapine? Very common, greater than 10% incidence, adverse effects. Dry mouth. Dizziness. Headache. Somnolence, drowsiness. Of 15 antipsychotics, quetiapine causes the fifth most sedation. Extended XR formulations tend to produce less sedation. Dose by dose than the immediate release formulations. Pharmacodynamics. Quetiapine improves the positive and negative symptoms of schizophrenia and major depression by acting on various neurotransmitter receptors, such as the serotonin and dopamine receptors. In bipolar disorder, it improves both depressive and manic symptoms. A note on suicidality in young patients and administration in the elderly. Quetiapine can cause suicidal thinking or behavior in children and adolescents and should not be given to children under 10 years of age. It is important to monitor for suicidality if this drug is given to younger patients. In addition, this drug is not indicated for the treatment of psychosis related to dementia due to an increased death rate in elderly patients taking this drug. How does quetiapine work? Although the mechanism of action of quetiapine is not fully understood, several proposed mechanisms exist. In schizophrenia, its actions could occur from the antagonism of dopamine type 2, D2, and serotonin 2A, 5-HT2A, receptors. In bipolar depression and major depression, quetiapine's actions may be attributed to the binding of this drug or its metabolite to the norepinephrine transporter. Additional effects of quetiapine, including somnolence, orthostatic hypotension, and anticholinergic effects, may result from the antagonism of H receptors, adrenergic alpha-1 receptors, and muscarinic M1 receptors, respectively. Half-life. The average terminal half-life of quetiapine is about 6 to 7 hours. How to use quetiapine. Schizophrenia. Immediate release. Day 1 50 mg/day PO divided Q12HR. Days 2 to 3, dose increased daily in increments of 25 to 50 mg Q8-12HR to 300 to 400 mg by day 4. Further adjustments can be made in increments of 25 to 50 mg Q12HR at intervals greater than or equal to 2 days. Dosage range, 150 to 750 mg/day. Extended release. Day 1, 300 mg per day. Subsequently, may be increased by up to 300 mg per day at intervals greater than or equal to 1 day. Maintenance, monotherapy, 400 to 800 mg/day. Patients who have discontinued therapy for 1 week should have their dose retitrated following initiation of therapy. Patients initiate at their previous maintenance dose if discontinued therapy 1 week. Bipolar I disorder, mania. Administered as monotherapy or as adjunct to lithium or D-valproex. Immediate release. Day 1, 100 mg per day PO divided Q12HR. Day 2, 200 mg per day PO divided Q12HR. Day 3, 300 mg per day PO divided Q12HR. Day 4, 400 mg per day PO divided Q12HR. Further dosage adjustment up to 800 mg per day by day 6. Should be in increments less than or equal to 200 mg per day. Dosage range, 400 to 800 mg/day, not to exceed 800 mg per day. Extended release. Day 1, 300 mg PO once daily. Day 2, 600 mg PO once daily. Maintenance, day 3 onward, 400 to 800 mg/day PO. Bipolar disorder, depressive episodes. Either immediate release or extended release tablets may be given, dosage titrated upward over 4 days. Day 1 50 mg PO at bedtime. Day 2, 100 mg PO at bedtime. Day 3, 200 mg PO at bedtime. Maintenance, day 4 onward, 300 mg PO at bedtime. Bipolar I disorder, maintenance. Administered as adjunct to lithium or D-valproex. Immediate release, 400 to 800 mg/day PO divided Q12R. Extended release, 400 to 800 mg/day PO in single dose. Generally, in maintenance phase, patients continue to receive same dosage on which they were stabilized. Major depressive disorder. Extended release formulation administered as adjunct to antidepressants. Days 1 and 2 50 mg PO in evening. Day 3 may be increased to 150 mg PO in evening. Dosage range, 150 to 300 mg/day. Alcohol dependence, off-label. 25 to 50 grams PO at bedtime may be titrated, not to exceed 300 mg. Insomnia, off-label. Usually, 25 mg per day PO at bedtime initial. Are there specific concerns about quetiapine and pregnancy? Pregnancy Category C, Risk Summary. There are no adequate and well-controlled studies of Seroquel use in pregnant women. In limited published literature, there were no major malformations associated with quetiapine exposure during pregnancy. In animal studies, embryo-fetal toxicity occurred. That's all the information about quetiapine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.